Hi, my name is Sarah Godfrey, and today I will be presenting on the deaf-blind special education classification. So to provide some background, deaf-blindness is defined by the Individuals with Disabilities Act, or IDEA, as concomitant hearing and visual impairments, the combination of which can cause such severe communication and other developmental and educational needs they cannot be accommodated in special education programs for children with deafness or children with blindness. In other words, what this is saying is that deaf-blind students have visual and hearing impairments that occur at the same time, and they will not succeed in a program that specifies for deaf or blind children. They need a unique and individual program. So for some defining features of the disability, approximately 1/2 of deafblind individuals have a genetic condition called Usher syndrome. This is an inherited syndrome that is recessive, and children who are born with Usher syndrome are generally born blind and have vision impairments that gradually get worse over time. Deaf-blindness may be accompanied by additional disabilities. This includes Down syndrome and trisomy 13. Trisomy 13 is another chromosomal disability. It occurs on the 13th chromosome, and physical and learning disabilities often accompany this. Fetal alcohol syndrome, maternal drug use, and other prenatal dysfunctions may also lead to deaf-blindness. There are other postnatal non-genetic causes that may lead to deaf-blindness as well. This includes trauma and head injury, meningitis, and stroke. Helen Keller, who is easily the most recognizable deaf-blind person, had a non-genetic cause. When she was 19 months old, she had a very severe illness that led her to become deaf and blind, but she was born with hearing and vision. As of 2016, there were more than 10,000 children between the ages of 0 to 21 who were classified as deaf-blind and receiving services in the United States. It is estimated that there are approximately 45 to 50,000 people currently living in the United States with deaf-blindness. Deaf-blindness does not occur more frequently in any specific race or gender, and age does not have anything to do with the occurrence. This is considered to be a low incidence disability, but within the disability there is a very wide range of how it could be manifested. A student who is classified as deaf-blind is not necessarily fully deaf and fully blind despite its name. A student may be fully deaf and visually impaired, fully blind and hearing impaired, hearing and visually impaired but not fully deaf or blind, or fully deaf and fully blind. And there is a very large range of how hearing and how visually impaired the student may be within these classifications. Students who are deaf-blind face very unique challenges in education, and this depends on the level of vision and hearing loss and other possible co-occurring impairments. So a student who is deaf-blind and has Down syndrome may be treated very differently than a student who is just partially deaf and blind. Deaf-blind students will often struggle with language development, motor skills, cognitive abilities, and emotional and social development. It is also a very isolating disease because many times deaf-blind students cannot communicate well with their peers. It should be kept in mind that you are not working with a deaf child who cannot see or a blind child who cannot hear. Deaf-blindness is a fully unique disability and should be treated as such. It has unique challenges in the educational realm. It is important to provide support and assistance to deaf-blind students. Having a sign language interpreter and a teacher of the deaf who is familiar with the disability is crucial to help teach life skills and provide cultural understanding. A general special education teacher may not be sufficient, especially if the student wants to embrace deaf culture. Deaf culture is a unique set of art, language, history that differs from hearing culture, And if the student wants to participate in such, having a teacher who understands this is very important. Also, many people who believe that they are a part of deaf culture feel that deafness is a unique human experience rather than a disability and prefer to be treated as such. If you're working with a student who has an interpreter, you should keep in mind that their only job is to facilitate communication. So you should still talk directly to the student you're working with, even if you're not sure whether they can see or hear you. The interpreter should not be used for disciplining the child or helping teach the child. Their only job is to communicate. It can be very confusing if they're expected to take on multiple roles. Providing alternative sensory stimulation, such as enhanced textures and kinesthetic touch, can be crucial in helping students learn, and providing resources in Braille may also be necessary. Hands-on learning experiences are essential for deafblind students because this is the most familiar and comfortable form of stimulation. Deafblind students may have delayed response time, and this is not necessarily in answering questions, but just in general conversations. So when you're working with them, please be considerate of this and allow extra time for responses. Trust is also extremely important for these students. They'll probably need extra time to be able to trust people and to trust their external environment. They cannot be as familiar with their external environment as a seeing and hearing person, so they need help adapting to changes quickly. Also keep in mind that unless a student that is deafblind has this accompanying with a learning disability, they should not necessarily be treated as such. Deafblind students do not necessarily need easier work, but they do need to learn differently than regular students, and this should be accommodated. There is a huge range of technology that's available to suit the unique needs of deafblind students. I listed a few here, this is not all of them. Screen readers can be given to deafblind students who have some level of vision so that they can enlarge and enhance print, and they can make it bigger, they can change the contrast and the brightness of it. Braille translation software helps translate printed text to Braille so that students who cannot see and are comfortable reading this way can use it. Teleprinters are more of an auditory learning method. Words can be typed in and then heard auditorily. This can also work over the telephone. Students can type in words and someone on the other end of the line can hear them. Also, depending on the level and type of deafness, cochlear implants and hearing aids may be used. If you feel that you're working with a deafblind student who needs additional support, there are a huge range of organizations that will provide assistance, resources, information, and training. Some of these include the American Association of the Deafblind, Helen Keller National Center for Deafblind Youth and Adults, the National Family Association for the Deafblind, and the Hilton's Perkins Program. Thank you.